My name is Leta Boylan. I'm an LPN and a CHES. I worked as an agency nurse in the Psych hospital at North Central Healthcare in Wausau, Wisconsin from 2017 until December of last year. North Central is a taxpayer-funded facility. On the adult unit in 2017, I had a 19-year-old trans-identified female patient who had already had a double mastectomy and who nearly bled out because testosterone caused her ovaries to become polycystic, and then they virtually exploded. On the adult unit in 2018, I had a trans-identified male patient in his 20s who was abused so brutally as a child that he was legally blind and had an IQ of about 70 related to a permanent traumatic brain injury. He was prescribed 4 times the amount of estradiol that oral contraceptive contains, in spite of the fact that he was unable to live independently or maintain employment. During the pandemic, North Central Healthcare opened a brand new youth psych unit, and by 2023, it had become not just a unit that I worked on, but the primary unit that I worked on. Many days, every single minor female patient was trans-identified. It was unusual for us to have no trans patients on a given day. Most teenagers experience suicidal ideation at some point. This is not a great part of the human experience, but it is also not an uncommon one. If a child who is struggling discloses suicidal ideation at school, it starts an unceasing cascade of interventions which occur without parental input or consent. School staff are legally obligated to report to law enforcement, who will remove the child to the emergency room, where the child is subjected to medical tests and placed on a 72-hour hold and then delivered to a facility like the one that I worked at. All of this is done without parental consent. Sometimes it is done without any parental contact. The implied threat of suicide is wielded with regard to gender dysphoria in a way that is utterly contrary to the standard, which acknowledges both the suggestibility of people who are actively experiencing suicidal ideation as well as the long-observed phenomenon of suicide clusters, which occur especially often in young people. In other words, they come in, say that they're suicidal, and we say, gosh, we shouldn't discuss that, unless you're trans, in which case we have to do whatever you say. Payer sources are billed fraudulently, utilizing misused codes. Medicaid fraud was commonplace. It was openly discussed during rounding. My minor patients, who were as young as 11 years old, would frequently change their names and pronouns. This was always kept a secret from parents. Clinical, educational, medical, and mental health professionals of perceived authority who had already proven that they could override the wishes of the child's parents were now also in the business of hiding things from parents. There is no acknowledgement on the part of the administrators that affirming a cross-sex gender identity in children is not a psychologically neutral act. It starts another unstoppable cascade of intervention, but this one ends in permanent sterility, disrupted endocrine systems, sexual dysfunction, mutilated genitalia, and an increased risk of completed suicide by every high-quality study that has been conducted on this issue.